Good morning, and glad to be with you on the program Perspectives. Perspectives this morning is a program sponsored by the Kaduna State Ministry of Health. And on the program, we talk about COVID 19, where we are with it in the world, and coming back home, where we are with it in Kaduna State. And of course, we'll talk about Nigeria. Yes, it's been a while now, but again, I'm just glad to be with you on the program this morning. And Professor Clara Ejembi is my guest this morning, and she's of the Public Health Department of Ahmadu Bello University, Zaria, and we'll be talking about what is trending the world over with COVID-19, and come back to Nigeria and come back home to Kaduna State, where we have it. Professor Clara Ejembi, good morning, and glad to have you with us on the show.
Yeah, good morning.
Yes. Prof, COVID-19 is with us, and again, the situation in the world is not that encouraging as it should be. So many deaths. United States of America has recorded over 400,000 deaths. And we're talking about what is happening in the United Kingdom too. It's not good news. They're in lockdown. So many countries in Europe too are in a lockdown. But we come back home to Nigeria and back home in Kaduna, where we're doing this because, again, the program is sponsored by Kaduna State Ministry of Health. So we come back to talk about Kaduna State. Kaduna State has been going up and down. We're having cases of coronavirus on the high, and then in another week we get it going down. But the situation, that we have globally, and talk about Kaduna State, your perspectives on this.
Okay, thank you very much. The pandemic, the COVID-19 pandemic, is in its second wave. In some places like France, they're even talking of the third wave. So that means that the epidemic had gone up, came down a bit, going up. And in some places it came down, it's going up again, like in France. In Nigeria and in Kaduna State, we are in the second wave of the epidemic. So that means that it had, from the time we had the first case in Nigeria in February, it spiked up, it went down a bit, and the number of cases being reported is going up. For Kaduna State, the situation is quite worrisome. Not only is it going up at an exponential rate, because now we are competing with Lagos and Abuja, the states with the highest reported cases before. But what is even more concerning about the situation in Kaduna is when you look at the proportion of the test results that are positive. Kaduna State is leading in the country, and that is not a good sign at all.
Yeah, well, Prof, one of the things that we see in Kaduna State, of course, talking about the metropolis, is that we see people, the protocols, people wearing masks now, it's all over. And of course, we talk about the task force, they're all over the place. And so we see the commitment, on wearing of the face mask. But what is it about Kaduna State? Are we talking about people not reporting, or coming out, to have themselves, tested and all? So why is Kaduna State, going on the rise and of course coming down again? What would you say could be the
going up? It has not been coming down.
So what?
It's going up.
It's going up. Sometimes we see that.
So that means that the experience in Kaduna is bad compared to other states of the country. Because if I test 10 people and 4 or 3 are positive, If others are testing and only 1 out of 10 is positive, then I have a more serious problem, isn't it? And the test is random. But I would want to commend the government of Kaduna State because it has made testing its priority. The governor has given his marching orders to the Ministry of Health to test, and ensure that at least 1% of the population is tested. Consequently, we have decentralized testing to local government level, and we have given them targets. And perhaps the results we are getting is as a result of expansion in the testing that we are carrying out. And maybe populations that we had not reached before, we are now beginning to reach them. So we are getting a more holistic picture of what is happening in the state.
Well, Prof, again, what would you say? I mean, this is we get it on the social media. Is trending. It's gone viral too. That people talk about the reality of COVID-19, and of course, back home here too, we hear some people that just do not believe that COVID-19 is real. And so, with what we get and what people are saying, the reality of COVID-19, are you shocked? Would you be shocked about people still not believing that COVID-19 is real?
You see, as you rightly said, we still have the doubting Thomases. People that are saying till they see, they will not believe. And a lot of misconceptions and things go around. They think it's a white man's disease, it's a politician's disease, big man's disease. They've not seen the thing before. All sorts of things. So it's correct that we still have high rates of misconceptions. And what we need to do as a state, as a country, is to start from where people are in their knowledge, in their beliefs, and develop risk communication, interventions, and strategies that fit to where people are, and embark on aggressive risk communication so that people will begin to perceive. Because even where people think that, okay, it exists, they think their risk of getting the disease is low, or they think they are invulnerable. And we need to begin to address it, because with this pandemic, a lot of people are coming down. Many people that we know, that we care about, are all dying. I think our 7 grades in Africa and Nigeria inclusive is that a high proportion of the infections that we see come without symptoms. But you never know whether you'll be part of the 20-15% of the population that will come down with severe symptoms and possibly die. In the past week, I have known of a lot of my colleagues that had lived in ABU that died because of COVID. My colleagues in the medical profession have died. I know them personally. So COVID-19 is real. We are all at risk, and we need to take concrete actions to prevent ourselves from getting infected, including availing ourselves of the vaccine that will soon be rolled out.
Prof, still on that, just ask you this. We know that we are, Nigeria, religious country. We hold on to our faith, and people say with the faith and with our religions, we say God give it, and of course that God take it. Are we doing a confusion with what we have to do about, COVID-19, keeping ourselves safe, or just holding on to what we believe, our faith, that God give it and God take it. Is that a problem with the issue of COVID-19 with us?
I think there's no contradiction between science and religion. Let's start from that premise. Absolutely no contradiction between science and religion. A lot of the things that we are advising people to do are in our different holy books. When they say stay at home because of a pandemic, wash your hands and do things, it's all in our holy book. As a Christian, a lot of these things are found in Leviticus. When they say even quarantine because of a problem, it's in our book. So there is no contradiction between the recommendations being given out and what is contained in our book. That's number one. Number two, God created man. God created abilities in man. And God has told us to go and dominate. And if God has given us the abilities and the wisdom, and He has given us the opportunity to make discoveries on what we can do to help our problems, are we now contending with God? We are not. We are not contending with God. We are appreciating the ability involved in us from God to do the needful. God did not create us in this world to be robots. Or else, why are we wearing clothes? God did not bring cotton and create clothes. He did not give us cars. He did not give us aeroplanes. He did not give us a road. But He gave us the ability to do this thing. So why is it that when it comes to what we can do to promote our health and to prevent certain diseases, that we are now going to question, the science against religion?
Okay, Prof, we'll have to go for a commercial break, and I'll just join you after this break. Welcome back. It's the program Perspectives, and it's coming to you on Invicta 98.9. And this program is sponsored by the Kaduna State Ministry of Health. It's a program to give you, to keep you well informed about COVID-19, what is trending in the world, and of course where we are with it in Kaduna State. And this morning, my guest is Professor Clara Ejembi of the Public Health Department, Ahmadu Bello University, Zaria. We're looking at COVID-19, and we're looking at the situation we have, the world over, and of course coming back to Nigeria, and of course coming home to Kaduna State, where we are with it. Well, Prof, again, back home in Kaduna State, what we're seeing, yes, COVID-19, and it's taking its toll on people, and of course, whether people believe or not, we know that COVID-19 is real. But the social media, I really want to take on that, is that we get all sorts of commentaries, coming from the social media about, what the world wants to do, and how they want to deplete, human population, and people saying that it's the white man or it's science that wants to reduce population of the world, and so COVID-19 is where they're taking us to, that they must reduce the population of the world, and so people don't even want to, go for testing, and people don't want to believe that COVID-19 is real. Are you worried about, trending events on the social media?
Of course, yes, I am. The World Health Organization says We have two parallel epidemics going on. The epidemic of the disease itself, which is COVID-19, and the epidemic of misinformation and miscommunication, which they call infodemics. And they say the infodemic is even worse than the epidemic of the disease. And you read a lot of rubbish on social media aimed at misinforming and disinforming people and countering every science and common sense. And people would rather believe the proponents of misinformation than looking for credible evidence from trusted sources or looking for scientific information. So when you start reading what they are putting in the social media, let's take the case of the vaccine that will soon roll out in the country, for example. People will begin to tell you the vaccine is going to change your DNA. So I don't know whether I'll stop being a human being and become an animal. They will tell you that it's going to create so many problems for you because either too long ago vaccines were produced. It takes about 10 years. Now within a few months they produce a vaccine. It's not safe. It's going to destroy you. From the Christian religion perspective, they'll tell you it's the Antichrist coming. There is a chip in the vaccine and all sorts of nonsense that is going out there. You know, and unfortunately, people don't take their time to look for objective reporting from credible sources. And perhaps it's because the social media, people, it tends to spread fast. Access is quite broad. And maybe people do not know how to access scientific information. But social media, even though we recognize the huge potential in terms of reaching people with information, it is unfortunately becoming a source of worry and problem to the medical profession as we try to reach out to people to respond to the COVID-19 pandemic.
Yeah, Prof, one of the things that has come out now is that it is our responsibility now to take care of ourselves and to keep ourselves safe. That's the reality of what we have now. In keeping ourselves safe and, of course, talking about the reality of what we have now, all the protocols, that have been put in place for us to observe, and, of course, that will keep us safe. What more? What is it that is lacking? And what is it about us that we do not, that we are not looking into to keep ourselves safe with COVID-19?
I think what we need to say is for a behavior change to take place, it does not happen overnight. And there's a process. And there are a number of theories out there in the open on what determines behavior change. Because whether we like it or not, at this point in time, even Nigeria will not receive a single dose of the vaccine. The only vaccine that we have is to change our behavior. The steps, the things we need to do have been articulated in the government's response in Kaduna State. And it's within the ambit of the Forward campaign. The fourth campaign says F is for use of face mask. O is observing social distance. R is respiratory hygiene. W is for washing our hands. A is avoid crowd. Another R is for resting at home. And D is diet. So all these things that we need to do, they are known to us, and I call it behavioral vaccine. People are not doing it. And when you look at, the theory of change, what are the things to get people to change? They need to perceive that they are at risk of COVID-19. And a lot of people, as I told you, think they are not at risk of COVID-19 for reasons that known to them. They need to perceive that this disease is severe, and of course, based on past knowledge and whatever it is. They need to perceive that there is benefit to implementing these forward things that we mentioned. They need to have the resources to be able to do it. And they need to have the self-efficacy that they can do it. And they need to have access to resources to enable them. For example, if I say put a face mask in the village, how many of them can afford the money? Or use a hand sanitizer? How many? And of course, we must have the information from a credible source, a trusted source. A lot of people are doubting government. When you go out there, they'll say government is telling them lies. They are using the cover of COVID-19 to go and get money, to go and spend on themselves. So they are not even trusting government, So all of these things put together, we assess the risks, assess the benefits, look at key to action, self-efficacy, enabling environment. And it's on the basis of that we see people taking decisions. I cannot, for example, go to a slump and say use social distance. How? I cannot go to a poor person and say use sanitizer. Where is she going to get it from? So all of these things, for us to ensure that it works, we need to work within the context of the realities of the people and provide the enabling environment to ensure that it works. But of course, the starting point is for even people to even perceive that this thing is real, and I'm likely to get it, and I'm likely to even die from it. If they have not come to that reality, everything down up the ladder, we are just wasting our time.
Yeah, Prof, you took that away from me. I was going to talk about, ask you the question about the trust deficit. That's, again, what is trending. People don't believe that government, because of what had happened and what is happening, that they could, hold on to what government or, leaders are saying to them. So it's about people not really believing that, government really cares. And of course, we see leadership by example. Some people say not there. And so is that a problem again with handling or tackling the issue of COVID-19 with us?
I think it goes beyond just COVID-19. To what extent has government built trust with the people they are out there to serve? That dividend has been lost a long time ago. You only see the politicians when it's time to campaign. They'll go and share rapage, or share beans, or share that, or share rice, share even Maggi, everything under the sun. And promise heaven and earth. They come back only 4 years after. No engagement with the constituency, no accountability framework, absolutely nothing. And unfortunately, over time, the people have lost confidence in the government. And we need the politicians and people in power need to begin to rebuild that trust, such that when El Rufai comes to say he too got COVID, they will not tell me Rabu da shi kurun yana mana magana kurun yana so ya je ya nemi kuɗi. And I hear it all over the place. So that trust has been lost. And they need to begin to reclaim that trust. And for them to reclaim that trust, they need to identify what they need to do.
And well, again, Prof, I'm about to go, take on the audience now and hear from them. But again, the COVID-19, some people, again, it's a trending issue that some people believe that it's a rich man's disease. And it's been reported, we hear it all over, that the rich, are dying. People on the, up and mobile, on the social ladder, they are dying. And so it's not a concern of, the people back on the lower rung of the ladder. When you look at this, can you put a thought on this?
Unfortunately, the data we have, we've not been disaggregating it by profession, socioeconomic status, and all. What we have in Kaduna State, we can tell you the number of cases by local government, the cases by sex, cases by age group, which are the things that we analyze routinely. And from the analysis we've done so far, there's absolutely no local government that we don't have cases from. Both men and women are equally affected from the epidemic. And of course, from anecdotal evidence, now not analysis of statistics, from the cases that we see, there's no socioeconomic group that is not affected. That's from the treatment centers and the home-based care. So if that is the case, I can boldly say the epidemic in Kaduna State, as in other parts of the world, is not discriminated by socioeconomic status, by age, by location, by occupation, or any other thing. Okay? So everybody is at risk. And the severity of the disease depends on a number of factors. Your pre-existing condition, a health condition. Whether you have your age is one, that's biology. The older you are, the more at risk you are. Pre-existing conditions like whether you have diabetes, hypertension, heart disease, kidney disease, asthma, tuberculosis, and conditions that compromise your immunity. So if you have those things and you develop COVID-19, you are more likely to suffer severe infection compared to other people. And we want to continue to stress the point that about 80% or more of the people that are infected do not show signs and symptoms of the disease, but they are capable of spreading the disease to other people. And these are the people we are worried about. And that is why government is calling out, get tested, get tested, get tested. So that if you are positive, at least if you isolate yourself, you reduce the chances of spreading the disease to other people. Over.
The program is Perspectives, and we're talking about COVID-19, reality of it with us, and it's a program sponsored by the Kaduna State Ministry of Health. It is to give you information and to, get you educated on COVID-19 and, of course, why we must, keep ourselves safe. We're coming back to the audience now. Your observations, your thoughts, and, of course, make comments, too, on what you're saying. Are we helping the situation, or, if we're not really doing what we have to do? And so let's get to hear your thoughts on COVID-19 and the reality of it with us. And numbers to call to be part of this program: 081 40,989, 081 40,989, or 070 87 800 989, 070 87 800 989. We're taking calls now. Hello, good morning. Hello, good morning.
Hello, are you ready?
Yes, good morning.
James is my name.
Okay, let's hear you.
I'm calling from Buaya.
Okay.
You see, we are preparing graveyards rather than preventing the disease coming to the people. I expect the government to give us immunity-boosting drugs or food to the poor so that their immunity can be higher than where they are now, rather than going to look for oxygen something. When you are getting oxygen, you are nearer to death. So please, let the government boost the immunity of the citizens rather than preparing when they are closer to death and say you are giving them oxygen. That's my take.
Okay. All right. Doctor, you are the caller there. Government to... Yeah. No, you didn't get that. Okay. The caller was asking about, calling on government to boost the immunity of the people. And, of course, for food, too. Boost immunity, I'm just wondering how, and then, of course, he talked about food to the people, too. And, this may just be going down the line of palliatives and all of that. Your thoughts on this, Doctor?
Okay. I think, first and foremost, your frontline defense against any infection is eating good food. Eating food that contains the appropriate nutrients that will boost your immunity. And the onus of responsibility is on you, not on government, to ensure that you are not eating junk food. You are not going to McDonald's, you are not going to all sorts of other places, you are not doing processed food. You eat, and honestly, in our environment, we can find good food. You don't have to buy meat. If you have beans, you have the dawa, you have soya beans, you have all those things. You have alefu. Every season, God has so blessed us that every season, there's some immune boosting foods around. Green leafy vegetables, if you are not there, carrot, cabbage, all those things around. Okra is there, this one is there, that one. So we have so many things that God has blessed us to be able to prepare them in a way that we can enhance our nutrition. The first line of defense is good nutrition. So we need to educate ourselves, first and foremost, about how to boost our immunity in terms of diversification of food, in terms of fortifying the food, and in terms of getting supplements. So supplements is even the last point, like multivitamins and all of that. The first point is how do we diversify our food, and how do we prepare it in such a way that we don't destroy the nutrients that we need in our body. So we need to educate ourselves first. And a lot of things around, can do garden around our place. I do ogu, I do okra, I do all sorts of things around my house. And a lot of people can do small gardens around their house to get the fence. And obviously, we do know that beyond that, some people have economic constraints to getting the food that they need. Because if government come and give you maize, give you rice, is the rice going to contain all the nutrients that you need? No. You will need some other things.
Okay, I have another call here coming in. Hello, good morning.
Morning.
Good morning.
Good morning to the doctor.
Hello.
Good morning. Can you hear me?
Yes, I can now. Your name and where you're calling from?
Sunday from Malta.
Okay, let's hear you.
Yeah, I want to talk to the doctor. And I hope she's staying safe as well. Because of the incident that happened in Kano, about 15-something doctors were infected with the COVID virus. What it means is that talk is cheap. Sometimes they come on radio, they speak, they themselves don't observe the protocol necessary to the people. By the way, she made mention of trust from the government to the people. And I want to tell you that how can the people trust government to hide palliatives from them? Ordinary food that people are eating to get damaged. How can the people trust such a person to hide food away from them? How can the people trust the government who cannot protect from bandits and terrorists? It's going to be very difficult for somebody who cannot protect me against bandits. So wants to protect me against COVID-19. It's impossible.
Okay, I got you on that. Doctor, very interesting angle that this caller is taking. First, is talking about frontline workers, that, how safe are you, the frontline workers, with this pandemic going on, ravaging the world? How safe? And of course, going by what is happening. And then asking the question too about trust. How can we trust a government that is not doing what it ought to do? Again, looking at what is the situation on ground about Boko Haram and banditry, and of course kidnapping and robbery, all of that we're seeing, and how much government has done about keeping us safe too. So how can you trust this government with all it is putting out?
Okay. So number one, relating to frontline healthcare workers, I think in terms of improving the work environment in such a way that they are protected and they to reduce their risk of getting infection in the workplace, both at the national level and lower levels. I think Kaduna State has made some investments at the national level. I do know that the National Primary Healthcare Development Agency conducted training for all primary healthcare workers working in primary healthcare facilities. And at the state level, trainings have also been conducted because I participated in some of these trainings. They have also provided personal protective equipment, and they continue to provide it. Whether it is sufficient is another thing, but the state government has been committed to making provisions for personal protective equipment by way of face masks, hand sanitizers, and then the gowns that they need to gown depending on where they are working. Training of healthcare workers have also been conducted. They've purchased things like Veronica buckets to put at the entrance of health facilities, such that patients come in, at least they wash their hands. Infrared thermometers have been procured and distributed. The infection prevention control component of the response, the pillar, has been going around trying to ensure that there is triage of patients and the protocols that have been put in place at both primary and secondary level, targeting both private and public facilities, are cared to. And almost every day at the meeting of the emergency operating committee, operations committee of the COVID-19 at state level, people bring reports of their assessments and actions they've taken to date. So in terms of investment in the response to reduce what you call nosocomial infection in the workplace, either for the health worker or the patient, Kaduna State has been making significant investments. What is worrisome for us is that in spite of the training, in spite of the investment, a lot of health workers are taking COVID-19 with levity. And when you go there, you don't even see them wearing face masks. You talk to them, they just laugh. And so health worker infection rate in Kaduna State is among the highest in the country. So health workers also need to take responsibility and do the correct thing.
Okay. Well, Dr. Professor Clara Ijembi, I'd like to thank you for coming on the program this morning. Thank you for coming on the program. And now, at the size of the program, Perspectives this morning. This is program sponsored by Kaduna State Ministry of Health, and it's just to inform you, keep you abreast of what is trending the world over, and of course coming back home to Kaduna State, and of course we must appreciate the government of Kaduna State for getting people involved and informed too about what is trending and keeping us safe from this pandemic. So we come back with this program on Thursday. Program sponsored by Kaduna State Ministry of Health. I'd like to thank my colleague Kianchat, for getting me, across to the people this morning. We'll come back with Perspectives tomorrow. Good morning.